Hello, hi, welcome to the Glowing Skin Series. I'm Christine Ho, and today I have Ira Pastor. He is the Chief Executive Officer of Bioquark. So, hello, welcome, and thank you for being here.
Hi, Christine. Thanks for having me today.
Oh, yes, of course. So grateful to have you. So, yes, tell us your own personal story.
Sure. I am I was trained as a pharmacist early in my career who went to business school and spent the last 30 years or so in one facet or another of the traditional pharmaceutical industry, everything from big pharma sales and marketing to biotech to retail and distribution. And it's really where I've spent my time sort of learning this industry in terms of sort of therapeutic products and biologics and so forth. And it got to a point where, as interesting as it was and exciting a place, I became a little dismayed by the fact that we weren't having a great record at coming up with true cures for disease. We were very good at creating treatments for things in terms of the symptoms and the outputs of a disease. But when it came to really changing the human body, when it came to sort of taking a disease and turning it back in time to a point when you weren't diseased, these are things that were more futuristic. And sort of this time around in my career, I wanted to do something a little more creative, a little more earth-shattering. And so I'm currently the CEO of a company called Bioquark, and we are actively involved in sort of the next generation of human regeneration, disease reversion, and ultimately rejuvenation of aging tissues.
Well, yeah, that sounds amazing.
Yeah, it's exciting, and we take a lot of our lessons from nature. The last 100 years has been dominated by sort of the exploration of certain parts of the natural world in terms of the plant, bacterial, and fungal communities. We're going to the next level. We study all sorts of wonderful organisms like amphibians that can regenerate limbs and spinal cords and major organs. We study other organisms like zebrafish that can get cancer and revert it into normal tissue. And then we even study things like the immortal jellyfish, which likes to age in reverse. And ultimately, we're asking the questions, ultimately, how do these dynamics happen? And how can we create a sort of biologic moieties and other substances, bioproducts, that can be useful for human health, wellness, and disease? And that's our goal this time around.
Yeah, that sounds remarkable, and that can help so many people, which is great. So yes, so how exactly does the skin rejuvenation work that you use with cellular regeneration?
Well, yeah, absolutely. So we are, as we are with sort of the therapeutic side of our company, we're very interested in approaching the skin, once again, not from the output, sort of, we know that there are people that focus on inflammation and oxidation and all the other things that can happen to the skin and the changes, the late stage changes that occur. We're very interested in what happens before. So basically looking at the skin as what it is, the largest organ in our body, which has miles of blood vessels and nerves and pores and billions of corpuscles and so forth, and studying the many cells that we possess and how we can apply the same regenerative stimuli via biologics and bioproducts to the skin, and remembering that the skin is much more than just a barrier, but it is a very complex, integrated organ, whether we were talking about keratinocytes or melanocytes or fibroblasts. It's really an integrated system. And so we look at how we can apply bioproducts, whether they're for wrinkling, for diseases of the autoimmune system, say like psoriasis, and how we can, number one, increase and enhance regenerative turnover. I mean, we think of the skin as terminal normally, but depending on disease state and age, that process can be slowed down substantially. So we want to enhance regenerative turnover in the skin. We're also interested in the whole process that we see in nature about how different tissues are very good at organizing out the cells they're not interested in and those that they are. So, there's a lot of attention nowadays given to the topic of senescent cells, sort of the cells that have come to their useful endpoint in life, but still hang around your body and don't do a lot of good things for it. So not only are we looking at regeneration, but we're looking at the dynamics of reorganization using the same bioproducts to get rid of those senescent cells from the skin entirely. And lastly, we are interested in, the beauty from within principle as well, because as many noxious stimuli that come from outside of the body in terms of pollution or radiation, sun damage, dehydration, and so forth, your skin gets a lot of signals from within. So epigenetic changes, inflammation from other parts of the body, oxidative moieties that float around your bloodstream. So we are not only looking at how we can apply sort of pharmacotherapeutic interventions to the external part of your body, but also how the changes via some of the other studies that we're doing internally trickle up to the skin. So really approaching it from both sides of the equation, because it is, as mentioned, the largest and probably most sort of underappreciated organ that we have in our bodies.
Yeah, no, that sounds remarkable and very amazing type of work. So you've actually worked on both the inside and the outside of how they work on each other. So like, what are some, what are some signs and symptoms that show on the skin that you would recommend cellular regeneration for?
Okay, there's really three major classes. So we are looking at general, if one can think of sort of the general appearance sort of indications, where we're talking about skin wrinkling, skin discolorations due to aging, hair loss, a lot of the typical situations where there is a need for a regenerative turnover and let's say, a refreshment or a rejuvenation of sort of the underlying skin microenvironment that is responsible for wrinkling, the hair loss, a lot of the changes in the different pro-inflammatory cytokines that exist in the skin. Secondarily, from a pharmaceutical perspective, but this is important for the whole story, we are very interested in oncology, specifically skin cancer, and we spent a lot of time studying melanoma because of the amazing death rate that still comes from this disease. And here we have a case of not just the need for regenerative turnover, but in the case of genetic damage and epigenetic damage that occurs in a disease like melanoma, which is a horrible skin cancer, how we can erase the epigenetic history that led to a cell becoming melanoma in the first place and revert it to a normal state. So this is a very exciting area of ours that we're applying beyond skin cancer. We're also looking at brain cancers, breast cancer, and so forth in our own research. But this is a very important area of ours, and not just for the sort of the more devastating cancers, but also things like benign diseases like actinic keratosis, which is still a major problem. And lastly, and this is a newer area of ours, but nonetheless, we think it's very important. We've created a new program recently focused on rare diseases, specifically those in the skin that manifest in a mosaic format. So there's many genetic diseases in the skin. A couple examples would be Bloom syndrome or epidermolysis bullosa that manifest in this external mosaicism where you see healthy cells and genetically damaged cells mixed. And the reason you see this is because the body's natural regenerative turnover allows some of the more beneficial phenotypes to bubble to the top. So we are very interested not just in looking at sort of epigenetic type damage in sort of autoimmune diseases, say, for things like psoriasis, but at the same time looking at genetically damaged skin, inherited mutations, where we can use our same technologies for the organization of the skin tissue to get rid, once again, of the cells that are less fit or damaged and increase the regeneration of healthy tissue to organize out what the body and the skin doesn't require. So those are really the three major baskets that we as a company are focused on as it pertains to the skin.
Okay, yeah, that is remarkable and definitely amazing work. So are there any things that you can do right now to help people with cellular regeneration?
Yeah, I mean, we are both a pharmaceutical company, but we are also a consumer goods company, and we've spent a lot of time with some partners and are bringing a series of topical and nutritional products to the market as we speak that are going to be focused more on the appearance enhancement, wrinkling, skin discoloration, more of the cosmetic indications, and those will be launched through different brands. Forest Organics is our in-house brand, and we'll slowly but surely be releasing a series of products to the market on those fronts. And at the same time, just from a more sort of actionable perspective, we are just a very, because we study nature and we're very focused on today and what we can just naturally do in our lives, the one thing we like to point out, whether it's things like proper nutrition or dehydration, appropriate hydration and water, it's very important to realize that we are all human. And though, we do possess the genome of many species that came before us, we still have to live, eat, drink, and so forth appropriately for who we are. And, obviously things like drinking lots of Coca-Cola or exposing ourselves to excessive amounts of radiation or inflammation is not good. And always, just due to the fact that it is the largest organ, it will always, whether we're talking about diabetes or in other inflammatory conditions, it will always trickle up and affect the skin. And we need to, once again, live appropriately for who we are as a species.
Oh, yes, of course. So is there like, how exactly do those products that you mentioned, the nutritional products and the topical products, how do they work in order to help obtain better skin for, the audience?
Yeah, so we basically, there are versions of what we'll call the biochemical cocktails that we are creating in the laboratory right now on the drug side, but more sort of natural product in nature. And they are basically combinations of biochemical moieties that can mimic, in essence, the regenerative cycling of tissues, including the skin, and the cellular reprogramming, turnover, and remodeling that we see in normal regenerative organisms. So, for instance, we are not, in the mechanisms of these substances, we're not looking, for instance, at, say, inflammation or using the material as an anti-inflammatory directly, but basically turning back a cell that is damaged so it is promoting excessive inflammatory signaling to a point prior to that time. So in essence, what a lot of these organisms that we study have in common is, in essence, an ability to turn back biologic time in their cells. And when I talk about biologic time, I'm not talking about chronological time. I'm talking about everything that has changed since that organism was a baby. The epigenetic, the genetic, and all the other damage that occurs to our cells. So we are following the same dynamics that we study in the lab, the same biology of how that damage is erased in the cell, so we can take a cell from point B and naturally turn it back to point A to start over. And we have a lot of proxies in nature in both non-human species, but at the same time in human species, because there are cases in humans where we see this reorganization and reprogramming dynamic occurring. So that is the main difference between how a product like we're developing and are bringing to the market are going to be presented, as opposed to other products that may just have an anti-inflammatory substance or an antioxidant substance. We are upstream of those mechanisms, and that's quite exciting for us.
Oh, yes, of course. So when can the audience expect to see your products come out?
Well, we link to some of these now on our website, and we are in real time now negotiating distributor relationships both here in the U.S. and around the world. So look for come to our website. You'll see links to both the Forest Organics site there and other relationships that we have in Latin America, and one that we're forming in Europe right now on different brands. So you'll see sort of our technology as well as our brand name in a series of products in 2018.
Okay, that's so great. Yeah, definitely something for a lot of people to look forward to, I'm sure.
Absolutely. We're excited.
Yes, of course. How can you not be, right? Yeah, so what are you most proud of from 2017?
Most proud of 2017, in addition to the development of these consumer products, has been our work specifically in the area of neurology in terms of spinal cord injury models, as well as the continued work on what we are doing in oncology and cancer. And this has, in both cases, because these are biologic abilities that we don't normally think of as humans of having, in terms of the ability to reconnect severed spinal tissue, in terms of paralysis, and in terms of cancer, the ability to revert a tumor as opposed to kill it. We've been very excited in the results that we're seeing in some of our large animal models, and this will be, a continuing sort of focus of us moving forward, because these, one might argue, cardiovascular disease is equally important, but between oncology and the amount of deaths we have from cancer still, and the sort of the coming waves of Alzheimer's and dementia and other neurodegenerative diseases in the next 10 to 20 years, these are two places that we really feel are very important for us to continue the research programs.
Yeah, that's amazing. So you were actually able to revert a tumor back to its original state to where it was before it was formed?
Yes, we've done that with melanoma models. We've done it with adenocarcinoma models, and recently glioma models. So this ability, we see it in fish, we see it in amphibians, you see it in certain worms and other, let's say, lower organisms, but it's very rare in humans. So the fact that we are able to transition those dynamics into mammals, rats, a guinea pig, rabbit, is exciting, because mammals, while we have very good wound healing capabilities, as an example, we have very poor natural cancer reversion capabilities. So we're excited about where this program is going, as well as everything else.
Okay, yeah. I was just suddenly thinking about, oh, those poor animals getting treated.
Yeah, we unfortunately we're in the we're still in the window there where we can't always go directly to humans for things. So, but I'll foresee a day when that will be a possibility.
Of course, yes. So what are you most excited about for 2018?
Most excitingly is our continued work in neurodegeneration, and specifically Alzheimer's and Parkinson's disease, just because this is such a unmet medical need. And, I joke a bit, but a couple of weeks ago, Pfizer, the largest, fourth largest drug company in the world, announced, they were getting out entirely of Alzheimer's and dementia research, which is shocking to me, that, a $60 billion company just abandons probably what is, many would say, is the most pressing healthcare issue that we have coming towards the older population now, and we need to address it. And so our ability to regenerate the central nervous system tissues, and also revert disease processes, and now they're connecting Alzheimer's up with the sort of third form of diabetes, and metabolic dysfunction and sugar levels and so forth. It's all connected. So whether we can revert and normalize sort of glucose metabolism to affect the skin, or whether we can do it to affect the central nervous system, it's all interconnected. And when we have more rejuvenative capabilities on a whole body basis, like other organisms do, a lot of these diseases that unfortunately are major killers of us nowadays and take away our quality of life will not be so threatening anymore. So we're excited.
Oh yeah, that sounds very amazing, especially for those who actually have, who are suffering or have family members or friends who are also suffering from those, certain
Right.
types of diseases, which are very, very, I'm sure there's a lot, profound number of people. So that, I think that's,
Millions.
yeah, something that would be definitely very, very to look forward to. So actually, how far along are you guys in helping to cure those diseases, each one of
Um, Alzheimer's and Parkinson's, we're still a few years away from clinical application, just because we started a little later. We're much more advanced on the spinal cord injury front, and simultaneously, something I didn't mention too much here, but we are also very active in the kidney, and the regeneration of the endogenous regeneration of kidney tissue. So these are things we're a little more advanced on, but yeah, it's just a function of time before we get into the clinic and first in human. But we think the ability to demonstrate, well, as we say, endogenous regenerative capabilities in humans, in any chronic organ, is going to be a major inflection point, and whether it applies, because we're not developing drugs for specific targets. So the same sort of basket of regenerative, say, biologic capabilities will be used in the kidney as they will in the liver or the pancreas. It's the same platform, so it can be kind of universal for us.
Okay, yeah, that's actually very amazing and definitely something for a lot of people to look forward to, I'm sure.
We're excited.
Yes, of course. Yeah, so tell us all about your free gift.
Sure. So as mentioned, we have the in-house brand Forest Organics that's been coming online. So we are talking right now in terms of a basket of products, including the Forest Organic brand night cream. We also have incorporated our natural biologic materials in lip balms, and some of the nutritional products as well, for the sort of health and wellness maintenance purposes. So we will put together a basket of these products as our thank you.
Oh, of course, yes, that's definitely something very much to look forward to.
This is just a small handful that I have with me here. But if you want to come to the website and see more, we can always modify the gift based on someone's interest.
Oh, yes, of course. And if you want to obtain that free gift, please click on the link below. And also, can you also explain some of the ingredients that are inside that free gift?
Sure. I mean, so there is a basket. When I say a basket, we're not developing purified drug substances like the pharmaceutical industry. We think of our products more of natural biologic cocktails. So in these products is a proprietary protein or peptide mixture that we specifically have spent time studying the last 10 years, that is responsible for the let's say the reprogramming and remodeling effects. At the same time, we have to keep our mind out about so-called drug delivery. So there are obviously some natural emollients and other sort of non-proprietary biologic factors that enhance permeability in the skin. And for the oral formulations, we have to be concerned about the gut and acid and peptides, peptases and so forth. So we have some natural protease inhibitors in there that allow transfer through the gut, and also some sunflower liposomal components. So all natural ingredients, but once again, thinking about the overall system, both the inside and the out.
Oh, yes, of course. That's definitely something that's very great to know. And I'm sure a lot of people are very happy to learn more about it. So yes, once again, Absolutely. If you would like access to that free gift, please click on the link below and opt in. And so trying to think about like how I can try to stretch this a little bit longer,
Sure.
to make the review at least 30 minutes. Is there anything else you're possibly able to share?
Yeah, so another area that has been, it's earlier on in our plan, because one of the things people ask about is infectious diseases. Now, you don't normally think about infectious diseases and regeneration usually, but there is one area that we have just recently gotten involved in, and that is basically in terms of viral extinction. I'll give you a quick heads up on this one, because, and I'm thinking of this more from a skincare perspective because of herpes simplex 1, but other viruses as well. Regenerative microenvironments, whether they be naturally generating embryo tissue or the limb of the salamander, you even see this dynamic in plant kingdom, are very good at silencing viruses. This is very important because, for instance, an embryo cannot, unlike the rest of our bodies, when we get a virus, we have an interferon-based antiviral response. Embryos do not. And so nature and evolution has come up with very innovative ways to not only silence viruses, so babies are not born with viruses, but extinguish them entirely. The dynamics called viral extinction. And so we are now studying, earlier than our traditional programs, the viral extinction capabilities of the regenerative dynamic. And this opens an entirely new way to think about diseases, of course, like herpes, but other viruses, of course, whether it's hepatitis, whether it's HIV, whether it's the common cold, and once again, not interfering with later stage sort of enzymes or replication, but actually the wholesale capability of how cells and tissues can quiet, silence, and ultimately extinguish viruses from having a pathogenic effect. And this is, once again, earlier, but nonetheless falls into the basket of this whole concept of starting over, cleaning up the genome, and rejuvenation. So another exciting area of ours. I'll be able to talk more about that in, say, 2019.
Hopefully your work can definitely help to cure and improve the lives of so many other people.
Yeah, we think so.
That's all the time we have here on the Glowing Skin series. Tune in tomorrow and watch the next guest. So once again, thank you for joining us, and bye.
Thanks for having me.
Of course, yes.